We are live, Senators.
All right, here we are back with Senate Health and Welfare on January 12th. And Katie McFlynn is here, Ledge Council. Katie, why don't you help us understand what we did in the last session?
Sure. So good morning, Katie McFlynn, Office of Legislative Counsel. There is Ameren. So I'm just pulling up the presentation. So what Ameren and I are going to discuss with you today are the 2021-2022 biennium bills that moved through this committee. You asked that I jump ahead and start with Act 45, which was the child care bill, because we've just been talking about child care. So I'm just going to let Amber know that we're jumping ahead in the presentation, and then we're going to come back and start at the beginning. So let me move this. So the presentation is organized numerically by act numbers. So you can guess that the lower act numbers were items that were passed during the first biennium. One of those bills is Act 45, and this was a child care bill. So this bill did a number of different things. This act itself is covered over the course of 2 slides. So first, we just spent a lot of time, or we just heard a lot of testimony about the CCFAP program, Child Care Financial Assistance Program, and that is the subsidy program. And we heard from the department that about 20% of the kids who are currently in childcare take advantage of that program in some form. So what this act did was it changed how the subsidy payments were structured for families. Prior to this, each child in a family would have a co-payment, and this changed the structure so the family itself had a co-payment instead of by each individual child. So that was one change. It also changed the fact that children under 150% of the federal poverty level, families under 150% of the federal poverty level, no longer had any co-payment at all when they were participating in the program. And it increased the families who are eligible to receive any type of assistance, even if it was a portion of the full subsidy, to 350% of the federal poverty level. So it sort of increased the amount of families who could take advantage in some degree of the subsidy program. Other changes that this act made, it changed the payment schedule to providers and the way that providers were reimbursed. So DCF does a market rate survey every 2 to 3 years. I forget if it's 2 or 3 years now, but they look at what the rates are for childcare all over the state, and based on that survey, it's 2 years. Based on that survey, they will determine the reimbursement rate caps. And also within that is the STARS program you heard about. That's the quality in childcare, and there are different tiers of STARS. A provider could have a 1-star program or a 2-star program. So that is sort of built into the rates that are received by providers. Also, there was language about the Bright Futures Information System. This is an IT system that's required by the federal government. And the DCF is in the process of putting that IT system together. What this act did was identify an end user group to provide advice and recommendations to the department as the IT system was rolling out. There were also 3 workforce development programs that were created by this particular act. One with regard to scholarships for current early childhood education providers. Second, scholarships for prospective providers, people who would like to become early childhood providers. And lastly, a student loan repayment assistance program for people who are in the field. So the latter of those 2 are set to expire on July 1st, 2026. The first one is not set to expire. That's an ongoing program.
Before you move on, just a question, just to kind of have a sense of the trend, because this is the first session I've been associated with. What was the zero copay limit? Now 150%. What was it previously?
Prior to that, I don't know if there was a 0 flat rate. I can't remember. My recollection is that that was new.
Okay.
as of this act.
And then the 350 for the upper limit of.
Maybe 250, I'd have to go back and look at the legislation, yeah, but it was a pretty significant bump.
Is this considered session law because some of it?
When we go through our first bill together, I'll sort of walk you through the difference between session law and codified law. I guess the easy answer is there's a mix of both in this act. The short-term like reports that are due and it's only sort of relevant to folks for 2 years. A program that might expire, those are more likely to be in session law. But then the changes to CCFAP that are ongoing, changes that are going to be in the books for a long time, those will be codified in the green books. And then the next slide. Okay, so this is the second slide on Act 45. And this sort of gives you a sense of some of the reports that were required by this particular act. And I know you're all anticipating one coming in on Tuesday, so that's a pretty big one. So first, this required the Child Development Division to submit a report addressing the costs and policy implications associated with moving from attendance-based model to an enrollment-based model in the Child Care Financial Assistance Program. The division has bumped back the due date on that particular program. They've received permission, so you haven't received that particular report yet, but the concept of that is that families who are able to fully pay for a child care program out of pocket, they are not necessarily forced to withdraw or not to receive a benefit if they take a vacation or if their child's sick for a long time. Whereas in the CCFAP program, if it's attendance-based, the child physically has to be in school to receive a benefit. They're more likely to lose a benefit over time if the child is sick or if there are certain circumstances that pulls the child out of school for a period of time. So it's, I guess the idea behind it is trying to create some equity there. The next report is a report that has already come into the General Assembly. It came in July 1st. And I think of it as the systems report. How does the child care system work? It's an analysis that was done. So it directed Building Bright Futures, which is a public-private partnership that sort of looks at
Federally determined, yeah.
that looks at early education in the state and provides guidance on early education in the state. So they were to issue a request for proposals to select an independent consultant. They did that. And this person had expertise in the field of childcare, early education, and they provided an analysis and recommendations on Vermont's childcare and early education systems for children from birth through 5 years of age. So that's a report that you have right now accessible to.
And did we get that? I think we have that on our
Website.
I hope, I don't know. Seen it.
It's on the reports page for sure. I don't know if it's on your committee page, but it's also going to be hyperlinked in a chart that I'm bringing you with all the reports that we're bringing you with all the reports. And then the last report is the one that you're anticipating on Tuesday. That's the financing report. I know you were interested in the exact language in that report. Do you want me to pull that up or do you want to sort of move on?
Why don't you go through this part first and then we might come back to that.
Sure.
Yeah.
Okay.
Because we do want to get to other, to Ameren and to Jen, so, yeah.
So this report, this RAN report that we keep talking about that's coming out on Tuesday, JFO was required to contract with a consultant, RAN, to evaluate the economic impacts of and potential funding mechanisms to adjust Vermont's regulated childcare system for children birth through 5 years of age, but also giving consideration to the intersection between older children 6 through 12 years of age who might be receiving summer care, after school care, before school care, and sort of looking at the financing of how those systems could work together. So that is a high level overview of what was in Act 45. I'm going to go back to the beginning of the presentation now.
It's okay. Any questions here? I know this is a lot to assimilate, but let's just keep going.
Okay,
unless there are some questions of understanding at this point.
okay, and I know there are a lot of slides in this presentation, so I think we're gonna try to give you a fairly high level overview, so
We can read it on our own.
Okay.
If you just give us the big picture, that'd be great.
All right, my turn. For the record, Ameren Abergere, Legislative Council. So for the first couple slides, what I did was pair two bills, one from each session in the biennium because they were related to each other. So the first ones being Act 6 and Act 85. These are extending healthcare regulatory flexibility during and after the COVID-19 pandemic, and then coverage of healthcare services delivered by audio-only telephone. So Act 6 was in 2021. This was to extend a lot of those provisions we put in to help the state manage the pandemic around healthcare regulatory issues. So originally, many of these were due to expire on March 31st, 2022, and so they were extended for an additional year. And I also wanted to point out that in Act 6, this act also requires health insurance plans and Medicaid to cover all medically necessary, clinically appropriate healthcare services delivered by audio-only telephone to the same extent they would cover the services if delivered in person. And so then also in Act 85, in addition to having that 1-year expansion again of those COVID-19 related regulatory flexibility provisions, it creates a registration process to allow out-of-state licensed healthcare professionals to deliver healthcare services to patients in Vermont using telehealth during the period from April 1st, 2022 through June 30th, 2023.
And just as a heads up, you know, I know the House will be, I think the House will be starting work on the telemed stuff. So, but we'll be getting information on this and working on this going forward because it's a whole new arena and area for healthcare delivery. So there are a lot of regulatory pieces and oversight pieces that we'll have to put in place.
So related to telehealth, these next two acts, Act 21 in 2021, and then Act 107 in 2022, regarding facilitating the interstate practice of healthcare professionals using technology, and then also Office of Professional Regulation Authority to approve provisional licensing. So in Act 2021, there was the creation of a working group to compile and evaluate methods for facilitating the practice of healthcare professionals throughout the United States using telehealth modalities. There was a report that was due back in December 2021. And then in 2022, you have the creation of a telehealth licensure and registration system. So it allows healthcare professionals who are not otherwise licensed, certified, registered in Vermont, but if they are licensed, certified, and registered elsewhere and in good standing, they could then obtain a telehealth license from the Office of Professional Regulation or the Board of Medical Practice to provide healthcare services to someone in Vermont. So in addition to that, Act 107 allows the Director of the Office of Professional Regulation to issue 90-day provisional licenses in any field to an individual who has completed an application for full licensure. And then there are other criteria to meet, but it is unrelated to telehealth, but is related to facilitating people coming in and out of Vermont and still being able to practice while they wait for their license, their full license.
okay. Act 30, an act relating to miscellaneous provisions of mental health law. There was language already in statute that discussed a consent form for individuals to sign when they're receiving voluntary treatment in an inpatient psychiatric unit. And this added to the language that folks would be consenting to, that they understood that treatment might occur on a locked unit and that potentially the person may be changed from a voluntary status to an involuntary status in the hospital if the healthcare provider felt that the person's condition had changed. There also, there's existing language in statute that said certain information had to be posted in a psychiatric unit. And so this adds to the language that would be added to those postings to include statutes pertaining to the process for changing the patient's status from involuntarily at the hospital to voluntarily there. And then lastly, there was language that required the Department of Mental Health to oversee, collect information, and report on data regarding the use of emergency and voluntary procedures. We call those EIPs, and that is seclusion, restraint. So restraint meaning physical restraint or chemical restraint, emergency and voluntary medication for patients admitted to a psychiatric unit, regardless of whether the patient is under the care and custody of the commissioner. And it also extended an existing reporting requirement to this year, and it pertains to patients seeking mental health treatment in the hospital setting.
Oh, we're gonna get that report soon.
Yes. I'll keep going. Act 33, this was an act relating to addressing disparities and promoting equity in the healthcare system. This act established the Health Equity Advisory Commission to promote health equity and eradicate health disparities among Vermonters, including particularly those who are Black, Indigenous, or persons of color, individuals who are LGBTQ, and individuals with disabilities. And we have a list here of all the responsibilities of the commission. I'm not going to go through all of those in the interest of time, but I'll just flag that one of the tasks was to provide strategic guidance on the development of the Office of Health Equity, which has not yet been created. There's also a second slide, and this more pertains to data collection and reporting requirements. But there was language in the act that required all state entities that are collecting health-related individualized data to disaggregate health equity data by race, ethnicity, gender identity, age, primary language, socioeconomic status, disability, and sexual orientation, and that data related to race and ethnicity shall use separate collection categories and tabulations disaggregated beyond just a non-white category and a white category, based on recommendations of both this commission that was created and the executive director of racial equity. And then there were a number of different reports that were coming in, including how to disaggregate data. That's one report. Recommendations on how to use fiscal year 23 ARPA funds. And most of those reports were required to be built into the commission's annual report. So you'll see when we go through the reports due to this committee that this commission is providing a report to the General Assembly every year.
I don't think we've gotten the first one yet. We extended it.
I think you did get a
We got-
report last year.
Oh, we got it.
I at least remember sitting in on testimony. I think there
Yeah,
was a
okay.
report. Act 36, an act relating to restrictions on perfluoroalkyl and polyfluoroalkyl substances, otherwise known as PFAS, and other chemicals of concern in consumer products. This really covered a lot of ground. So first there were regulations with regard to the discharge, testing, or use for training purposes of Class B firefighting foam, to which PFAS have been intentionally added. There are also language that unless it was required by federal law, that there not be sale or distribution or manufacturing of this Class B firefighting foam, to which PFAS had been added. There is an exception built in for terminals that a waiver could be granted. My understanding, we just talked about this yesterday in Human Services, that there's only one terminal in the state, and that's in Burlington. And then there's also language that prohibits the manufacture, supply, or distribution of a residential rug or carpet, aftermarket stain or water-resistant treatment for rugs or carpets, or ski wax, to which PFAS has been intentionally added in any amount. And I'll tell you that while this act was enacted, there were some rolling effective dates, so not all of these pieces have taken effect yet. For example, I think the ski wax was January 1st of 24.
You mentioned there's a terminal and it's in Burlington.
Airport.
It's at the airport.
No, so this exception is terminal. So the way it was described was they called it a tank farm. So they store petroleum, and so the reason that you want to be able to put out very hot fires very quickly. And so they had a waiver to be available so that this Class B firefighting foam containing PFAS could be used at that type of facility until there is an alternative substance that could do the job quickly, yeah. Okay, second page. There was existing law with regard to chemicals of high concern to children. It is a program by which if certain listed chemicals are in a children's product, the manufacturer has to disclose that information to the Department of Health. And there's a whole method in the statute by which additional chemicals can be added. So there were 3 new chemicals added in this act. There was also a lot of language with regard to not just PFAS, but chemicals and food packaging. So there's language prohibiting food packaging to contain PFAS, prohibiting food packaging from containing certain inks, dyes, pigments, adhesives, stabilizers, coatings, plasticizers, etc. That contain orthophthalates. And then there was a rulemaking section that took effect that empowers the Department of Health to prohibit certain food packages from containing bisphenols when certain criteria are met. I'll keep going. Act 37, changing subjects. An act relating to establishing Emergency Service Provider Wellness Commission. I won't go through into all the details, but just to kind of give you a high level, there was a lot of testimony with regard to this bill about the trauma that emergency service providers experience when they're sort of thrust into very crisis-like situations over and over again. So a commission was established. It had an enormous amount of representation from all facets of the emergency service provider community. So this group is an ongoing group and they do provide recommendations to the General Assembly annually.
That was a
We've
powerful.
already done Act 45. We can keep moving along.
All right. Act 48 is an act relating to eligibility for Dr. Dinosaur-like coverage for all income eligible children and pregnant individuals regardless of immigration status. So this act requires the Agency of Human Services to provide coverage equivalent to the coverage under the Dr. Dinosaur program to children and pregnant individuals who are not eligible for Dr. Dinosaur because of their immigration status. The coverage for this became available on July 1st, 2022, subject to fiscal year 2023 appropriations.
We can stay up here because I'm looking at how many slides. we have. Yeah, keep it up here because we'll look at the details and then folks can ask specific questions as time goes on.
So Act 61, an act relating to healthcare practitioners administering stem cell products not approved by the U.S. Food and Drug Administration. So this is just requiring this, it's a disclosure written notice requirement that practitioners who administer one or more stem cell or stem cell related products not approved by the FDA provide each patient with a written notice before administering that product for the first time. And this also specifies that a healthcare practitioner's failure to comply with the notice advertising disclosure requirements constitutes unprofessional conduct.
This bill and the PFAS bill and this bill, and I think a couple other bills really have received a lot of national attention. And this one in particular, the stem cell researchers and physicians were very interested in this at the national level. It's a niche issue, but very important.
Next is Act 97, an act relating to modification to Vermont's patient choice at end of life laws. I forgot to mention earlier, so Katie and I cover almost all of the subjects in this slide, but there are still a few healthcare subject areas that our Chief Counsel, Jen Carby, is still handling, and one of those is end of life laws. I don't know if you want to do this slide or if you want me to walk through and then.
Sure, I can do this one. Jen Kirby, Legislative Counsel. So Act 97 allows a physician to use telemedicine. This is the patient choice at end of life. I'll stop for a moment to say is is the term that the statutes use for what some people call medical aid in dying, death with dignity, physician-assisted suicide. There's different terms that people have used. That's kind of the topic here. So as passed last year, the law now allows a physician to use telemedicine to interact with a terminally ill patient who is requesting a prescription for medication that they would self-administer to hasten their own death, if the physician determines that using telemedicine is clinically appropriate. The act also eliminates a 48-hour waiting requirement after the last to occur of a few things that are spelled out in the law. The last to occur of the patient's written request for the medication, the patient's second oral request, they can make 2 oral requests for the medication, and the physician's offering the patient an opportunity to rescind the request. So there had been a 48-hour waiting period before the physician could write that prescription. After those events had occurred, the act eliminated that 48-hour waiting period. And then finally, the act specified, there had been some implication, but this made it specific that no healthcare professional would be subject to civil or criminal liability or professional disciplinary action for acting in good faith compliance with the statutes on this issue around patient choice at end of life.
Next is Act 99, an act relating to enrollment in Medicare supplemental insurance policies. This act requires the Department of Financial Regulation to collaborate with health insurers, advocates for older Vermonters and other Medicare eligible adults, and the Office of the Healthcare Advocate to educate the public about the benefits and limitations of Medicare supplemental insurance policies and Medicare Advantage plans. I'm just going to note that there is a report requirement in this act. It's a report that you will be receiving sometime in January.
A lot of interest in this one.
Yeah. So the department had to convene a group of interested stakeholders to consider issues around Medicare Advantage plans and Medicare supplemental coverage, and then report back. So that report is due January 15th. Act 108 is an act relating to health insurance coverage for hearing aids. So it requires that large group health insurance plans cover hearing aids and related services beginning in the plan year 2024. And it also codifies the requirement that Vermont Medicaid cover hearing aids and related services, and requires the Department of Vermont Health Access and Department of Financial Regulation to report on or after November 1st, 2022 on the state's applications to the federal government to modify the essential health benefits in Vermont's benchmark plan in order to provide this coverage.
So these are the
service-
ACA plans that
Right.
Nolan was talking about, and we need to have some government, the federal government, to allow for us to cover whatever we want for hearing aids. Because they're not currently in the benchmark plan. Every ACA plan has benefits defined. So we would be looking to see what would we have to do to get hearing aids included in that benefit. That's
So next was Act 112, an act relating to the provision of mental health supports. This required the Department of Mental Health to work with the Agency of Education and Agency of Human Service to submit federally required mobile crisis needs assessment to the committees of jurisdiction. So that's our report you'll be getting. It also directed the Agency of Education in consultation with DMH to contract with one or more organizations to provide COVID-19 recovery supports for educators and school staff in fiscal year 23. It required the Agency of Education to work with the Department of Mental Health in establishing and administering a 2-year program utilizing a tiered support approach to ensure that continuous support to children and youth in a variety of settings, including supervisory union and district-wide, in-school, community technical centers, and after-school settings. And lastly, it directed the existing Vermont Interagency After-School Youth Task Force to submit its bi-monthly reports to legislative committees of jurisdiction.
This is the reference that Dr. Levine made yesterday to $3 million, so that we found $3 million in federal dollars to support these programs. And it's been very welcome in the community. We'll come back and get some overview of this, a little oversight.
Okay.
Next, Act 113, an act relating to planning and support for individuals and families impacted by Alzheimer's disease and related disorders. First, there's an existing commission on Alzheimer's disease and related disorders, and this amended the membership of that group to add the executive director of the Blueprint for Health. It also replaced a member of the commission representing the business community with a member representing hospitals. It required the commission to submit a report containing recommendations to achieve a dementia-capable workforce and to improve provider response to Alzheimer's disease and related disorders. It requires DALE, Department of Disabilities, Aging and Independent Living, to include individuals with Alzheimer's disease and related disorders on the state plan on aging. So I should just step back to say there's an existing requirement that a state plan on aging be produced. And so this requirement was to integrate the needs of individuals with Alzheimer's disease and related disorders, specifically with regard to home-based care placements, hospital and long-term care placements, and transitions to and from home, hospital, long-term care settings, support for families, caregivers, and strategies to promote affordable and accessible long-term care, home and community-based services for individuals experiencing Alzheimer's disease and related disorders. It requires the health department and DALE to develop and maintain public education materials on the disease for patients, families, caregivers, healthcare providers. It requires the Agency of Human Services to submit a plan to the General Assembly to fund a permanent Alzheimer's disease coordinator position that would be shared between DALE and the health department. And it also required the Department of Public Safety to submit a report to the General Assembly with regard to recommendations for broadcasting information on missing persons with Alzheimer's disease or related disorders, cognitive disabilities. So something akin to Amber Alert or Silver Alert if such a person were to be missing. Act 115, miscellaneous Department of Health programs. This truly is miscellaneous. So they're one of the offices, the Alcohol and Drug Abuse Program was renamed to be the Division of Substance Use Programs. There was language requiring pharmacies that operate 10 or more establishments in the US, including concurrently within Vermont, to enroll in a drug disposal kiosk program, or if they physically don't have the space to provide a mail back option. There is language that would permit the health department to share de-identified data acquired or produced by the child fatality review team with other states that have a similar fatality review team, as long as the security and privacy protections are similar between the states. It directs the chief medical examiner to submit a report of a death to a federal prosecutor or a prosecutor in another state upon request. Previously, they had to be subpoenaed for them to release that, so this allows the sharing of that information. There's language requiring the Office of Professional Regulation to notify the Commissioner of Health and any relevant professional regulatory boards if the legislature requires an assessment by OPR of a regulation of the profession. And lastly, this act created the Working Group on Services to Individuals with Eating Disorders. They will be producing a report in the coming months. I can't remember if it was February or March now, but you'll be getting that shortly. Next, Act 2018, I'll give you the high level on this one. There were a number of opioid settlements that the state and different municipalities participated in, the result of which there were a large number of settlements for treating opioid use disorder or providing prevention services, intervention services. So that money was coming into the state, but a lot of the settlements specified a structure for which who would be receiving the money, a set fund for that money that was coming into the state, and also specifications for how that money could be spent. So this piece of legislation creates that structure for the settlement money to come into the state, be considered, and then appropriated and go out to the programs as a working group, an advisory committee, and the General Assembly determines.
It's a big chunk of money. And we're gonna have Monica Hutt in, who's the Chief Prevention Officer. she'll be in next week sometime, and we can ask her what progress is being made here. This is really, it's like, is it $84 million over 15 years?
I can't remember the
Yeah.
specifics now.
I spent a lot of time on that, thing,
Substantial.
reading through it, working with the administration on it.
Excuse me. Act 119 is an act relating to patient financial assistance policies and medical debt protection. This act establishes minimum standards for financial assistance policies at hospitals, hospital-affiliated outpatient clinics and facilities, and ambulatory surgical centers. It sets forth processes for the facility's implementation of these policies, specifies the steps the facilities have to take to publicize and notify patients about the policies, and then prohibits the facilities from selling their medical debt. It also requires hospitals to submit a plain language summary of those policies to the Green Mountain Care Board as part of the hospital fiscal year 2025 hospital budget review process.
Yes, Act 129. This created the Office of the Child, Youth, and Family Advocate. This is a state office, but it's independently of, it operates independently of other departments. And the office is charged with advocating for the welfare of children and youths receiving services from the Department for Children and Families directly or through funds provided by DCF, or those involved in the child protection and juvenile justice systems. So the legislation sets out the office. It discusses how the advocate is selected. There's an oversight commission that provides names to the governor, and the governor needs to select a name, and then it goes to the Senate for confirmation of that individual. So I think yesterday we said we were day 30 in the process, and the governor has 45 days to select a name. So I suspect soon there will be a name for the Senate to confirm. And the legislation also discusses not only the advocate's responsibilities, but obligations in terms of confidentiality and preventing any conflicts of interest in the office between any of the employees and people who are providing services to children and youth.
Act 130 is an act relating to miscellaneous changes affecting the duties of the Department of Vermont Health Access. So this act eliminates a 2-visit per year limitation on Medicaid coverage for preventive dental services for adults. And then it updates and consolidates provisions relating to the pharmacy best practices and cost control program, which is at the Department of Vermont Health Access. Next is Act 131, an act relating to pharmacy benefit management. This is another subject area that will be handled by our chief counsel, but I can keep running through the slides. That's either of it. And so this act directs the Department of Financial Regulation to monitor the cost impacts of pharmacy benefit manager regulation and recommend changes as needed to promote healthcare affordability. So it expands certain prohibitions and requirements for pharmacy benefit managers, and then provides additional rights to pharmacies during the PBM audit. It requires the Department of Financial Regulation, in consultation with interested stakeholders, to consider issues including PBM licensure, spread pricing, pharmacist dispensing fees, and with the Board of Pharmacy issues regarding pharmacist scope of practice. So you will be receiving a report with DFR's recommendations and findings January 15th, 2023.
Next, an act relating to miscellaneous changes in the Reach Up program. The Reach Up program on the federal level is referred to as TANF, Temporary Assistance to Needy Families. It's a financial benefit to families that qualify for assistance. Various changes made. It's expanding the definition of dependent child, so a child could be considered dependent for a longer period of time. It increases the amount of income disregard, the amount of the family's earnings that aren't considered when determining the family's eligibility and their benefit from 250 to 350. And it also increased the monthly amount of child support payments that pass through to a participating family from $50 to $100 a month. It required a case manager to utilize universal engagement model, and it amended existing law to employ a collaborative and empowering tone with regard to family development. And I almost would stop there and say that's one of the biggest things that act did. It's sort of hard to capture, but it changed the tone of the way families were referred to in the collaboration between the department and the families participating in the program. It replaced certain work requirements with requirements that allowed for employment preparation and employment readiness. It allowed previously only one parent in a two-parent family could participate in what's called a post-secondary education program. And this changed it to allow both parents in a two-parent household to participate in that post-secondary education program at the same time. And there was an appropriation to make IT changes that were needed to put these changes into effect.
So,
You say,
go ahead. No, go ahead.
when you say there was an appropriation there.
Yeah.
What is that?
That the General Assembly decided that a certain amount of money should be given to the Department for Children and Families for a particular purpose. So in this case, Children and Families said, in order to make the changes to the Reach Up program that you're asking us to make, we have to change our IT system. To change our IT system, it's going to cost $500,000. So there was an appropriation in the bill to make those changes so that the policy changes could also be made. Does that answer it? Okay.
Act 137 is an act relating to miscellaneous provisions affecting health insurance regulations. So first, it requires health insurers and healthcare providers to comply with the requirements of the federal No Surprises Act, No Surprises Billing Act. The act updates and further delineates requirements for an association or trust to be eligible to purchase a group health insurance policy for its members. There are some modifications to Department of Financial Regulations reporting and rulemaking authority. It creates a working group to increase access to appropriate mental health treatment for children and youth who are enrolled in commercial health insurance. And then lastly, it separated the individual and small group health insurance markets. This is on the Vermont Health Exchange for plan year 2023, and then is requiring DFR to report back after having convened a working group to recommend whether to maintain those separate markets or whether to remerge.
So what I'm gonna suggest is that we stop here. I know 285 is a big, Act 167 is a big lift, so I'm gonna suggest we stop here. And then I appreciate very much the time that you spent doing this. I hope it's useful. It's useful to me because now I'm remembering all the reports that we have coming in that are pretty significant, and we still have more to look at. So we'll come back to this. I know that we have time with you all. I think we have time up on. I know we're talking about reports on Friday, but maybe we can scoop some of this in as well. Jen, I don't know what your schedule is.
I'm mostly just here for backup.
Good, all right. That's good.
You've been busy.
So what I would like to do is to get Senator Gulick in here, and because we need to vote for a clerk. We need to- Thank you. That's good. That was thorough. That's great. And so you two are gonna do, are you, Katie, you and Amber, you're gonna cover the rest of the bills that are here?
We can.
Yeah, that would be good. I mean, we could do that. Is tomorrow Friday? Today's Thursday.
It's hard to keep track, yes.
Whoa, time flies when you're having fun. So, yeah, so maybe prepare to do that.
Okay, that sounds good.
That would be good. All right, so. Great.
Yeah, go ahead, Madam Chair.
Now, go ahead, we need to elect the clerk, so that's what the Secretary of the Senate has been hounding me for that, so I would accept nomination for clerk. Well,
I'd like to nominate Senator Lewis.
Okay,
Thank you, Senator Williams.
You're on.
okay, are there any other nominations? Do you accept the nomination?
I will accept the nomination.
Okay.
Maybe just to make sure the landscape is known and equitable, that we all know who's got other responsibilities now. So I think that's appropriate. Senator Hardy's the chairman. I think that we elected Senator Williams as a clerk yesterday in education. That might be new information. So I'm not sure if it's, it's necessary to get further into it, but I guess we're kind of looking for who's got available bandwidth.
And Senator
You're-
Lee's your vice chair of this committee, correct?
Right.
Yeah.
And you're vice chair of education, right?
Correct.
Well,
But being a clerk is not.
Being a clerk is different. It's a good experience. It's a very good experience. So, but, thank you for that. It's good.
We need to move to cease nominations.
Sure.
So
All right, all those in favor of closing the nominations, vote aye.
Aye.
Opposed? All right, so now the name of Senator Martine LaRoque Gulick has been placed for clerk of Senate Health and Welfare. All those in favor, please vote aye.
Aye.
All those opposed?
Thank you.
Better
Unanimous
not
vote.
be. Okay, you got your vote. And so, clerk is fun, and you two can talk about
Yeah. Yeah.
how it sugar's off.
And you met with Mr. Bloomer, correct?
And you can
in
do,
his office, they were very helpful.
Okay, great. I will do that as well.
and also make sure you talk with Alex
I
about this,
will.
and and when things start to happen, it happens. We
Great.
start voting.
Are we still on camera?
We are.
Okay, so we will now adjourn and go off live, and thank you all.